Ezekiel J. Emanuel, which country has the world's best healthcare? Embark on an enlightening journey into the complexities of global healthcare systems, as we traverse through Professor Ezekiel J. Emanuel's insightful book, Which Country Has the World's Best Healthcare? Offering data-driven comparisons and specific examples, this book gives us a deep dive into varying medical practices and the challenges different nations encounter. From the highs of the German and Dutch systems to the fractured U.S. healthcare landscape, we'll discover a gamut of practices, philosophies, and complexities that paint a picture of the current state of global healthcare.
Healthcare systems worldwide. Professor Ezekiel Emanuel, a renowned bioethicist, challenges the notion of the world's best healthcare system in his book. Instead, he analyses and compares healthcare systems around the world using data analytics and specific examples. Germany and the Netherlands are portrayed as having abundance, quality and value in their systems. Meanwhile, the US and China are ranked at the bottom due to their expense, unevenness, and for-profit shenanigans and bare-bones approach, respectively. The author concludes that no country has the best healthcare system, but many excel in different areas, making them worth emulating. The illusion of top-notch US healthcare. Despite perceptions of top-notch American healthcare, the US system is failing, spending $3.5 trillion in 2017, accounting for 18% of GDP. With underperforming coverage, quality, and cost, there are only 2.6 practicing doctors and 12.5 nurses per 1,000 people, compared to the EU's averages. The US healthcare system is broken, even though it spends almost twice the per-person average among OECD nations on healthcare. Americans are not receiving good value for their heavily invested money. Canada's healthcare system, metrics and perception. Conservative Americans perceive Canada's healthcare system as inefficient and socialist due to long wait times. However, using consistent metrics, the author shows that Canada spends 11.3% of GDP on healthcare with 2.7 hospital beds and 2.4 physicians per 1,000 people. The pros and cons of the NHS. The National Health Service, NHS, in the UK has been delivering free healthcare to its citizens for over 70 years. In his book, Emanuel admires this aspect of the NHS. However, he cautions that the UK spends only 9.6% of its GDP on healthcare, which is below the EU average. The UK also falls short in terms of the number of doctors, hospital beds, and nurses per 1,000 people compared to other countries like the United States, Germany, France, Norway, Switzerland, and the Netherlands. Despite its advantages, the NHS still has room for improvement and investment in the future. The Norwegian healthcare system. Norway's healthcare system is funded through taxes, without any access barriers, and covers health, pension, unemployment, disability, and other needs. Despite spending nearly double of what the UK spends, only 10.4% of GDP is used. However, physicians have little incentive to save money or offer quality care. Healthcare in France. Emanuel discovers the French healthcare system allows patients to choose any doctor or hospital and access specialists without referral. With 11.5% of GDP spent on healthcare, France boasts high numbers of hospital beds, doctors, and nurses per 1,000 of the population. However, the system is criticized for paternalism favoring doctors and disrespecting nurses. Germany's healthcare system. Germany's healthcare system covers everyone with too many hospitals, but spends only 11.5% of GDP on health. They have 8.2 beds, 4.5 physicians, and 13 nurses per 1,000 people. However, doctors and nurses earn less in Germany than in the US according to Emanuel. Dutch healthcare system. Emanuel presents the Dutch healthcare system as an example of effective macro and micro management. The Dutch doctors prioritize prevention and reluctant intervention. They spend $5,000 per person, which is almost $84 billion per year, on healthcare for a population of 17 million. By preferring to send patients home until their conditions worsen, the Dutch provide efficient medical care. Straining Swiss healthcare. Emanuel's article uncovers challenges faced by the Swiss healthcare system, such as high costs and overwhelming complexity. Despite the Swiss spending 12.2% of their GDP on healthcare, their system may be at risk due to potential rejection of high premiums. With 3.6 hospital beds, 4.2 doctors, and 9 nurses per 1,000 people, the author's concern highlights the need for reform to prevent a collapse of the Swiss healthcare system. China's struggle with healthcare. In Emanuel, it is evident that China's healthcare system faces significant challenges. Despite its vast population, the government spends only 6.2% of GDP on healthcare, with less than $1,000 per person. With just 4.1 hospital beds, 2.4 doctors, and 2.7 nurses per 1,000 people, the system is plagued by corruption and structural problems, impacting service delivery and patient care. Emanuel's findings highlight the need for China to address its healthcare challenges to adequately cater to its vast population's healthcare needs. Healthcare across nations. The book provides beacons for healthcare professionals, hints for policymakers, opportunities for investors, and a fascinating overview for laypeople. Emanuel argues that sound healthcare and the profit motive are mutually incompatible. Numerous insightful books offer solutions to the United States healthcare dilemma, and Emanuel's book is one of the most perceptive and useful among them. Elizabeth Rosenthal's An American Sickness offers a compelling historical perspective on how U.S. healthcare reached such a deplorable state.
While Professor Emanuel admits that no country can truly claim to have the world's best healthcare system, we witnessed an array of practices and approaches worth studying. From the efficient German and Dutch systems to the healthcare struggles in the United States, each country has its unique challenges and strengths. While the profit motive may be incompatible with sound healthcare, visionary policymakers and healthcare professionals can find inspiration in this book, unraveling a wealth of opportunities to elevate and revamp their respective medical care landscapes. While there may not be a single best healthcare system, learning from each country's experiences can lead to significant improvements in the overall quality and accessibility of care.